All right, so the next topic is substance use disorder. Really, really big topic when it comes to mental health because, you know, we kind of have a debate about legal and illegal drugs, and ultimately, medicines or drugs are kind of like band aids, I'm a big believer in psychology and therapy, even though I prescribe medicines. But I think illegal drugs help people mask their underlying illness. So, like, someone that has a cocaine addiction might have underlying depression, right? Because they need like an upper. Or someone that wants to escape their anxiety might have an opiate or benzo addiction because they need relief. So this is a great mnemonic. Tempt it with cognac. Use the criteria for any drug or alcohol dependence. Two of the following 11 criteria are required. Tolerance. The need for an increased amount of alcohol or drug to achieve intoxication. A withdrawal syndrome. The W. Loss of control of use of substance. So there's 9 criteria. More substance ingested than patient intended, unsuccessful attempts to cut down, much time spent in activities relating to obtaining or recovering from the effects of the substance, craving the substance. Substance use continued despite knowing the significant psychological or physical consequences. Important social or occupational recreational activities given up or reduced because of use. Failure to fulfill major role obligations in work, school, or home. Persistent social or interpersonal problems. Recurrent use in situations which are physically hazardous, like drinking and driving. So for alcohol use, there's a mnemonic called Cage Questionnaire. So have you ever felt like cutting back with drinking? Has anyone ever annoyed you with comments about your drinking? Have you ever felt guilty about your drinking? Have you ever had a eye opener in the morning to get rid of a hangover? If 2 or more of these are answered, there's a high probability there is an underlying alcohol use disorder. So basically, again, the acronym is tempted with cognac. So tolerance, withdrawal, and loss in control. And as I mentioned, there's 9 criteria that have basically cover, and you have to basically meet 2 out of these 11 to meet the criteria of substance use disorder.